What's up, guys? How's it going? Cade More with More Muscle. Today we'll be talking about the heart and we're going to be talking about cardiomyopathy. Guys, this is a disease of the heart muscle. It can cause the heart to have a harder time pumping blood to the rest of the body, which can lead to symptoms of heart failure. This can also lead to some other serious conditions. And there's not even a possibility of a need for heart transplant, depending on how serious it is, guys. So this is cardiomyopathy, guys, is what we'll be talking about today. Remember, guys, this is more of a learning experience. If you do have these symptoms, you need to go to a doctor and get diagnosed properly. And you need to basically go talk to a medical healthcare professional if you do have these symptoms. Okay, anyways. Some people with cardiomyopathy are asymptomatic. Guys, that means no symptoms. For others, as the condition gets worse, the symptoms get worse. Some signs and symptoms include shortness of breath, at rest, and even after activity. Chest pain, especially after physical activity or heavy meals. Heartbeats that are rapid, pounding or fluttering. Swelling of the legs, ankles, feet, neck, bloating of the stomach, fluid buildup, coughing while lying down, trouble lying flat to sleep, being extremely tired, feeling dizzy and fainting. As myocardio, as this gets worse, symptoms can get worse, like I said, and this is also, we don't know like what it's caused from. But it can be inherited, and some things that can cause cardiomyopathy are high blood pressure, heart tissue damage, long-term rapid heart rate, heart valve problems, COVID-19 infections, anything that causes like heart inflammation, metabolic disorders like obesity and thyroid disease and diabetes. Now, guys, remember, type 2 diabetes and obesity, those are preventable. You can take care of your health, you can do exercise, you can eat healthy foods that are low in calories and high in nutrition, and this can lower your weight. Diabetes type 2 is also reversible. There's so many people that are overweight, especially in the United States. And it is because of our food. We're eating foods like processed flours, oils, and even added sugar. And guys, these foods, they're very low in nutrition and very high in calories. And this is going to cause weight gain, and also it's going to cause lack of nutrition. So guys, remember, diabetes type 2 is reversible. Obesity is a choice. You can choose to be obese, you can choose not to be. That is a choice. Now, if you have a thyroid problem where your body doesn't produce enough thyroid hormone, where your metabolism slows down extreme, then that is not a choice. You will be obese because your thyroid is not functioning properly. But that is not the case with most people, and most people are overweight because of lack of nutrition and excess calories. Anyways, guys, lack of vitamins, minerals such as vitamin B1 can also cause this. Pregnancy, complications of iron buildup, lumps called granulomas, buildup of proteins, connective tissue disorders, drinking too much alcohol over many years. Guys, this is a controllable factor to cardiomyopathy. Drinking too much alcohol. You do not have to drink alcohol. And there has been studies that have shown that even a little bit of alcohol can be harmful to your body. In my opinion, I don't think there is a healthy level of alcohol. Find things that make you happy. You don't need alcohol. I know it's a big social, thing to get out and meet other people, and all your friends might be drinking alcohol, but you're not forced to drink alcohol. And over many years of excessive alcohol use, this can lead to cardiomyopathy, and that's something you don't want to have. And then use of cocaine, amphetamines, or anabolic steroids. There's a lot of people are using anabolic steroids these days. And people think, well, I'll just use anabolic steroids and I can get to my goals faster. Um, but there are a lot of harms that come with anabolic steroids. One being infertility. Another one is, like what I was saying, cardiomyopathy. Um, and also, guys, chemotherapy can also cause cardiomyopathy. Um, there are different types of cardiomyopathies. Sometimes the heart becomes thickened, stiff, or less flexible, or sometimes the heart chambers can grow. But keep in mind there are different types of cardiomyopathy. Risk factors include family history, long-term high blood pressure. Now, guys, most people they have high blood pressure, and it is changeable. If you eat a healthy diet with lots of fiber, if you exercise a lot, your blood pressure levels can go down. Guys, blood pressure is basically if you have high blood pressure, basically the heart's not doing a good enough job, and it needs to constrict its blood vessels, which can cause a heart attack, or that's why they call it the silent killer. They call high blood pressure the silent killer because there's not a whole lot of symptoms of high blood pressure, but you can die from high blood pressure. And guys, remember, long-term high blood pressure. There are a couple genetic factors to high blood pressure, but if you take care of your health, you can lower your blood pressure naturally, and you can avoid this problem. Guys, past heart conditions is also a risk factor. Obesity is a risk factor. Guys, that's a controllable obesity. You can keep in good shape. You can go run. You can go exercise. You can eat healthy. Obesity is one of those things that many Americans struggle with. I think like there's a lot of, you go to the Walmart, you go to the store, and you'll see a lot of people that are obese, and it's sad, but it's also it's hard. There's a lot of marketing towards people. You go to the store, there's tons of delicious snacks that are terrible for your health, and they have they have very low nutrition compared to fruits and vegetables, whole grains, and stuff like that. But yeah, guys, obesity is, it's easy to be obese in America because of all the foods, the choices, the addictions. Added sugar. The people that make our foods today, they see what can be the most addictive. They see what keeps people buying their products, but they don't care about your health. They just want the money. They want the sales. So, guys, obesity can be hard to accomplish, but if you guys watch my other videos, I'm gonna show you guys what to eat, what not to eat. And thanks, guys. Anyways, guys, long-term alcohol misuse is a risk factor as well. Guys, alcohol, like I said, no one's forcing you to drink alcohol. That's your choice. Illicit drug use, like cocaine, amphetamines, steroids. Risk factors also infection, deficiency in nutrients, vitamins, metabolic conditions, collagen diseases, drug toxicity, and dysrhythmias. Some other risk factors, or things that can increase your risk for cardiomyopathy, would be diabetes. Guys, when you get diabetes, basically your risk for everything goes up by like a ton. So once you get diabetes, your risk for any disease goes up. So people get sick, I think, like 3 times more. I think this is about true. I'm not 100% sure, but I'm pretty sure people that have diabetes go to the hospital 3 times more than a normal person. So then also thyroid disease can increase the risk. Storage of excess iron in the body, buildup of certain proteins and organs, connective tissue disorders, some complications, guys. This include heart failure, blood clots, heart valve problems, cardiac arrest, and sudden death, infection, embolic complications. So guys, these are not fun things to have, complications. You don't want to go through heart failure. You don't want to have blood clots. You don't want to have heart valve problems. Those things are terrible. They cost a ton of money. to get fixed. And no one wants that. No one wants to die prematurely. No one wants to say goodbye to their family at a young age. I basically want to get you guys to where you can prevent all of the preventables, guys, like obesity, like drinking alcohol. Those are things that you can control. There are certain genetic factors that people have, such as, a premature heart or something, or they have type 2 diabetes or something. That's something, sorry, type 1 diabetes, where it's something they can't control. But I would say 90% of cases in the United States of people dying prematurely can be prevented. And so guys, so let's do some prevention. No alcohol, control high blood pressure, eat healthy, get regular exercise, get enough sleep, lower stress. And then if you guys want to do the diagnosis, like if you want to get diagnosed, you got to go to a medical professional, and you can look for a rise of BNP, which is B-type natriuretic peptide. You'll get a chest x-ray, echocardiogram, ECG, exercise stress test, cardiac catheterization, cardiac MRI, cardiac CT scan, genetic testing or screening. Guys, all these things can diagnose you with cardiomyopathy. Treatment, you want to manage symptoms, improve heart's ability to pump blood, improve blood flow, lower blood pressure, slower heart rate, remove extra fluid and sodium from the body, prevent blood clots, beta blockers, calcium channel blockers, ACE inhibitors, anticoagulants, and you can also get a heart transplant. So guys, those are all the treatments. I like to focus, these things are really good, but I like to focus on the preventable things, like eating super healthy. You can eat lots of fruits and vegetables. That's like this is the thing, guys, when I eat junk food, I feel like my body retains fluid, which is a bad thing. But when I eat lots of fruits and vegetables, whole foods, I tend to flush out that fluid a lot better. And that excess fluid where your legs swell up, that can be a condition, that can be an indicator of heart disease. And then some other treatments are pacemaker, cardiac resynchronization therapy, heart transplant. And guys, let's talk about lifestyle changes. You don't want to smoke, you want to lose weight, you want to have regular exercise, healthy diet, lots of fruits and vegetables, those that are high in antioxidants like berries, leafy greens, and tomatoes can help with inflammation and oxidative stress. Aim for about 1,500 milligrams of sodium a day, no more than 1,500 milligrams a day of sodium, unless you're sweating a lot. Maybe you might need a little bit extra sodium. But a lot of our foods, processed foods, have a lot of sodium already in them, and usually it's very rare to see someone in America deficient in sodium. But if you are an extreme athlete, if you're running, marathons, you will need extra sodium, and sodium is a necessary nutrient that you need. So make sure you do get enough sodium, and you want to aim for about 1,500 milligrams a day. You want to avoid alcohol, manage stress, get enough sleep, and take meds as prescribed and regular health checkups. Thanks for watching, guys.